Okay, so this video is for the girlies interested in a clitoral reduction. There's a lot of confusion about this procedure and what exactly I'm doing during it. So be fully warned, this video contains surgical images of what we exactly do during surgery. Our patients have given permission for me to show you a couple of videos and a couple of photos to explain it further. So not many surgeons do clitoral reductions, and for that reason I get patients from actually all over the world for this procedure. It's very specialized, and many times when patients come to see me, they've already had a labiaplasty or clitoral hood reduction done, which is usually the wrong procedure from them and can actually make things a little bit worse. So clitoris reduction is for a condition called clitoromegaly, or in patients who feel that the clitoris is too big. Usually a telltale sign that it is the clitoris itself that's the problem and not the labia is if when the patient gets aroused, things get much bigger down below, and a lot of patients will express to me that they feel as if they have a small penis down there. Okay, so the key component when I'm doing a clitoral reduction is I have to safely lift the head of the clitoris and all its nerves up off the erectile tissue, because that is the problem. The patient has too much erectile tissue, and that erectile tissue can get bigger or smaller depending on how aroused the patient is. Other things can make it bigger or smaller as well, and that's what we're going after, because with the clitoris, for normal function, you don't necessarily need that erectile tissue at all. And when we fully take back this erectile tissue and get rid of it, we can lift the clitoris, reduce its size, and put it in the normal position. So in this picture, I've already made an incision and pulled the head of the clitoris back, and I'm lifting it up with its nerves. You can see the white erectile tissue, which is between my thumb and forefinger, and that is what we're doing. We're slowly but surely peeling those really important nerves off that white erectile tissue, which we are going to get rid of. Now, this is typically how much erectile tissue we're able to remove. We follow it back, and of course, it looks quite small in the picture here. It's only measuring like less than 3 centimeters, but this is the stuff that when the patient gets aroused can, of course, get much bigger. So this is typically what we're removing, but all the nerves stay behind. Now, in most patients, the head of the clitoris itself is too big. So typically I'll be reducing that down to a normal size, which is about 5 millimeters typically in diameter. So that's what I am doing in this part of the procedure. Now, obviously some of that sensory tissue will be gone, but we have to do that to reduce it down in size. But as you can see, I'm keeping all those nerves intact. And thankfully, patients report that sexual function when they're healed after this surgery tends to be excellent, and indeed better than it was before surgery, because of course they're not as self-conscious as they were when the clitoris was very large. Now, this surgery, because it's very delicate and I'm doing it under magnification, it usually takes me at least 3 hours. Once we've done the reduction of the clitoris itself, now it's like origami, we got to fix everything in where it belongs. So we're going to do a lift, we're going to tuck in those nerves, the other tissue there, and usually we'll do a clitoral hood reduction and very commonly labiaplasty as well, depending on the patient's anatomy before the surgery. The worst thing about this surgery is the swelling afterwards. Usually there's quite a bit of swelling when it's the genital area, but we do it as an outpatient procedure. Typically, most patients will go back to work in 1 to 2 weeks, depending what their job is. This is a procedure I'm very fond of doing because it's really a game changer for patients. Usually by the time a patient has found me, they've already had 1, maybe more labiaplasties, which can actually kind of uncover the clitoris and make things feel even worse. And so this particular condition can be very distressing to some patients, and with this, we're getting rid of that erectile tissue. I've never seen it recur. The patient won't get the clitoris sticking out every time she gets aroused like it was before. And we're just bringing things to the normal size and shape and the average size and shape that we usually find out there. If this is something you're interested in, please click the link in the bio. We're accepting patients and doing this procedure in Miami, Florida.